My pleasure to introduce you guys, Dr. Marcel Green and Richard Chang. Dr. Marcel Green is a distinguished psychiatrist recognized for his pioneering contributions to interventional psychiatry. He's a double board certified doctor in child and adolescent and adult psychiatry. His commitment to advance mental health care and to close the gap between mental and physical health is seen in his merging of traditional psychiatric treatment with advanced interventions as part of a broader, more comprehensive approach to wellness. Currently, he leads a team at Hudson Mind, an innovative branch of Hudson Health based in New York City. Hudson Mind stands at the forefront of interventional mental health practices, offering cutting-edge treatments like ketamine infusions, dual sympathetic blocks, and transcranial magnetic stimulation. We'll allow him to describe what that all means shortly. Richard Chang is the Chief Operating Officer of Hudson Health, where he oversees operations, strategy, and patient care as part of Hudson Health's broader mission to promote anti-aging and longevity through cutting-edge technologies, which we'll also expand on. And in addition to his work in healthcare, Richard is also known for his appearance on the Netflix reality show Bling Empire New York. Beyond his professional endeavors, Richard is a passionate advocate for mental health awareness and wellness. We thank you. Using his platform to destigmatize conversations around mental health and to promote self-care and self-love. We're all about that here, so thank you for taking the time to join us today.
My pleasure.
Yeah, so before we dive into Hudson Health, I'd love to hear from both of you about your personal connections to mental health. So maybe, Richard, you could start by just sharing a little bit about your background and what inspired you down this path.
Sure. I'm really happy and proud to be here. When CC, who's an old friend, asked me to be here, I said that I wasn't qualified, so I'm honored to be here and speak in front of all of you guys. My journey with mental health is a lifelong one, but I would say I really dialed in on the need for support, help through therapy, through leaning on my community, really later in life, in my early and mid 30s. I come from a community, an ethnic community where we're not really taught to speak about our vulnerabilities and seek out help. We're kind of that immigrant mentality where you put your head down, you power through it. And I think our parents' generation did a lot of that in order to survive and set a foundation for our families. But I think as you know, the next generation grew up, we didn't learn through our parents. And so when I discovered the power of therapy, the power of certain therapies in my 30s, I was just so inspired by how much it did for me. And thereby, I actually chose my career in healthcare simply because I thought that more people, like the people in the community, the ethnic community that I'm from, they need to know that there is help out there, that it's perfectly okay to be vulnerable, and that, you know, there's just so much information and so much technology and so much support out there available to you if you know how to look for it. So I'm not a doctor, much to the disappointment of my mother, but what I do well is occasionally tell a good story. I'm a pretty good business person, so my thought is I can use my skills to amplify work of people like Dr. Marcel Green, and that's how I found my career in healthcare.
Amazing. And a great segue to Dr. Marcel Green. Would you mind just sharing a bit about your background and kind of what brought you into healthcare?
Absolutely. So I am the son of economic and social migrants who climbed into the American middle class. My mother's an immigrant. My father was a migrant from rural South Carolina. They worked their tails off, 12-hour days, in order to get where they're at. Endless self-education courses at home. They gifted my brother and I that as a model for resiliency, as well as social and spiritual balance, which kept me humble and grateful to wake up each day. However, they didn't necessarily know how to nurture the trajectory of somebody who would soon become a doctor. And so in my course, I literally had to discover how to navigate each step along the way after high school, which was extremely humbling. In terms of facing absolute existential uncertainty, failure multiple times over, in many respects. I did figure out the key to getting into med school, and that's what brought me to New York City. I went to Columbia. And there I faced another challenge. There was no I had no idea how to integrate culturally into that environment and to even mirror some of the academic standards, which were not the standards in my own public schooling. And so again, more challenge. And then med school is inherently challenging. Being raised among multiple cultures, both economic and ethnic and social cultures, informed an interest in psychology. Who were these very different communities that I found myself in at multiple times in life? What were the norms that I had to adapt to in order to succeed and move forward? It just really informed an intrinsic interest, which led me to psychiatry. Navigating these various spaces involved tremendous mental health challenges. I mean, that's a part of development, to be honest, and committing to just being a better person. So anyway, that moved me towards psychiatry, which retained my interests. And I've had the privilege of practicing in the most populous city in the country. And so the range and wealth of experience was just absolutely and remains absolutely fascinating. I'm grateful to be here. I'm grateful that others recognize that that harsh journey I went through had some value. And I'm very honored to be invited to be here to speak about my journey, what I've learned along the way, and what it means for me to be practicing at the forefront of mental health care, because I want to give that gift to others, to anybody suffering from any sort of mental health challenge, because there is a way forward.
I think what's really impressive about that too is that you guys are both not just working like in traditional psychiatry, which is also still this like, very new relatively practice, but also just kind of pushing the bleeding edge of that space to, kind of make sure that the future is now. So a lot of appreciation for that. And it's just great to be working in a space that you have such a personal connection to. I too feel privileged to have that. Could you tell us then more about the practice at Hudson Health? Maybe we'll start with you, Richard. You could just tell us kind of about the overall business, and then we could drill down into Dr. Green talking about the particular treatments.
Sure. Broad overview, Hudson Health is a healthcare group in New York City. We currently have 2 locations in downtown Manhattan. Easy way to think about it is we have 3 subdivisions, each of which serve a different medical specialty. Hudson Mind, the interventional mental health practice, is one of them. The other 2 are Hudson Medical, a pain management practice, and Extension Health, which is a health optimization longevity practice. What I came in specifically to do about 3 years ago was to build Hudson Mind. Dr. Jonathan Kuo, who's not on this call today, but works closely with Dr. Green, he's the founder of the practice, and he was telling me as a friend that as a pain specialized anesthesiologist, he was doing amazing transformative work in the behavioral health space, specifically with 2 modalities of modern treatments. One of them is work with ketamine, specifically IV ketamine, intramuscular ketamine, or nasal ketamine therapy, which is called Spravato therapy. And then the second that really caught my and turned a light bulb on is called a stellate ganglion block, or an SGB. I know it's a mouthful. It was to me. I didn't remember until I heard it for the 10th time. But basically, the stellate ganglion is a group of nerves in your neck. And Dr. Green, anything that I say wrong, please correct me. But it's a group of nerves in your neck that has actually been proven to be responsible for your sympathetic nervous system. Okay. How this was discovered as a proper use for behavioral health is an anesthesiologist was using SGBs to treat chronic pain. And over many, many years and decades of work treating chronic pain, he realized, actually treating a lot of veterans, that their disposition improved, that they were nicer, that they were reporting that they were sleeping better, that their interpersonal relationships and the professional relationships were nicer, they were calmer, they were less reactive and irritable. And so when the light bulb went off and he figured out the correlation, he actually led 6 clinical trials in a 10-year period to prove that the SGB is actually the most advanced treatment modality for PTSD and trauma. That doctor taught Dr. Jonathan Kuo, the founder of our practice, as his protege. And since then, Dr. Jonathan Kuo has sort of taken it to the next level. We've done clinical trials for long COVID, brain fog, and then Dr. Kuo has continued to add other things to the SGB to make it our own and make it more advanced, inclusive of also injecting into the vagus nerve. What is this treatment? It's a treatment that has to be done by a very skilled physician or anesthesiologist. It's done in an operating room. It's an injection of basic anesthesia into that group of nerves in the stellate ganglion to essentially reset your sympathetic nervous system. What does that mean? If we're dealing with trauma, generalized anxiety, treatment-resistant depression, your body might be, in layman's terms, stuck. You're sort of always in this hypervigilant state where your fight or flight response is always elevated. If you live in New York City like me for your whole life, this is just how it is. You've heard of spider sense. You just don't want your spider sense to be going off all day long, every day, because when it does, your body will have a physical response to it. Sweaty palms, that tightness in your gut, that general anxiety, heat in your face or head. And so that injection that essentially resets your sympathetic nervous system can bring your physical response back to a baseline. I always like to describe it to my friends as if you have a laptop and you haven't reset it for a very long time and it seems to run really sluggish and slow, when you reset your laptop kind of goes back to its basic function. That's essentially what this injection does. Dr. Kuo and Dr. Green have improved it even more by doing a second injection into the vagus nerve, which is actually responsible for the parasympathetic nervous system, which is responsible for your rest and relax state. So on one hand, you're sort of decreasing the hypervigilance and your response to stimuli. And then the other hand, you get yourself to a more relaxed state. So again, this is work that's being done by physicians to work alongside psychiatrists like Dr. Green. Dr. Green actually performs these procedures himself too, because he has a surgical background. And it's just a really interesting point in the industry where you have the traditional behavioral health world, which is psychiatry, medication management, therapy, so antidepressants, anti-anxiety. And then you have this cutting edge world that is just holding hands together and really bringing the best care possible to people. The other modality that I didn't talk about is transcranial magnetic stimulation. Dr. Green can speak about it more, but I think we've all seen the movies where, you saw someone wears a helmet and there's electric shock therapy. This is the much more modern, FDA approved, less evasive, less scary, less demonized version of this. It's actually FDA approved for treatment-resistant depression, OCD, and it can even help people quit smoking. So there's all these therapies out there that some of which are FDA approved, some of which have been studied and done by tens of studies. And honestly, most people don't know about them. And to me, that's so sad and such an opportunity thinking positively.
Yeah, why do you think that is, or what's sort of like the curve and kind of getting wider awareness and adoption of these types of treatments?
I think part of it is education. I think part of it is, quite frankly, Dr. Green, don't take this the wrong way, but our physicians like Dr. Green, they're taught to be great doctors. They're not taught to be business people. They're not taught to be storytellers and marketers. And how do you market? Ask a doctor to market a stellate ganglion block. How do they run an ad? How do they get that message out there? How do they, and so it requires going across the table to find people like myself, much more intelligent, skilled people than me, to help tell that story, to help laymanize the work that the doctors do in order for people to know that there are these therapies that are out there. And again, some of this is really cutting edge, but TMS has been around for about 20 years. It's been FDA approved for over 10 years. It's covered by insurance. Some of these therapies are not just because they're so frontier medicine, but TMS is covered by insurance. So, it's part of it is information. I think it's information, it's marketing, it's stigmas. Ketamine, for example, right? It's often demonized. It's thought of as a street drug, as a horse tranquilizer, but used in a proper setting under the guidance and supervision of physicians like Dr. Green and his team, it could be an incredible tool. Psychedelics coming down the pipeline. At this point, I want Dr. Green to talk about this stuff just because, he'll do a much better job on the clinical side.
All right. So, it's important to recognize that when a potential clinical treatment is demonstrated to be effective, usually that's something that's demonstrated in some of the medical literature. There can be years actually before it's widely known, both among treating clinicians as well as the general public. And there's a number of factors that contribute to that. Number one, is there a financial interest in pushing this to the public, i.e., can somebody make money from this? If something doesn't necessarily have the potential to be patented, it may never see the light of day, even though it's known for quite a long time that it's effective. Number two, there's a general hesitation among physicians really to deviate from what's known, effective, and established by certain levels of study. And so even though among the psychiatric community, actively reading medical journals, there's knowledge about the stellate ganglion block. TMS is now mainstream, but ketamine is an example. It's known, some of the potential clinical benefits that are possible there. But again, in part, number one, because we work so much, we don't necessarily have the time to do what Richard is saying, is actually really promote these things. But also the time to dedicate to really, really honing in your knowledge on why these new treatments can and should, in some instances, replace some of the traditional things. And so there's a lot of factors that account for why it's not as widely known. But I will say that there are a couple forces converging which are pushing knowledge of this into the mainstream. Number one, there is a huge hunger to find other interventions outside of what's become traditional in terms of medications and therapy. That science has not truly, the science behind making these standards of care has not truly advanced in decades. And so the public sharing their discontent is driving that force to really bring to light some of these treatments. And also, just the science is advanced. Like Richard said, TMS is FDA cleared now. And so now the reluctance that physicians may have had to talk about it, that veil is lifted. And so it's truly mainstream. We're seeing that now with ketamine, which is, by the way, the first psychedelic to be reintroduced back to the public consciousness. We've known that psychedelics can play a role in mental health in the 50s, in the 60s. And for many reasons, a big one being the war on drugs and the stigma behind substances, tabled that science for decades. However, that science has been picked up again in the last over 10 years now. And now we have ketamine that's readily available, right? And so I'll talk about that. So anyway, so let me just expand just briefly on some of these interventions and just kind of bring them to a more kind of practical understanding. So for where it concerns the neural reset, that combines the stellate ganglion block and a vagus hydrodissection. So basically, when you're anxious about something, why do you even feel it in your body? Some people have heart racing, some people get breathless, some people get sweaty, even as something as simple as an interview. Why do you get sweaty? Some people have a sense of chest pressure, some people have tremors, some people have GI symptoms, nausea, vomiting, bloating. Why does this even happen? Because isn't anxiety confined to the brain? Right? Well, the brain tells the body to be on guard. This is stimulation of your fight or flight response. And that's through a known pathway of nerves. And so with the stellate ganglion component of it, you're targeting that pathway that activates the body and arrests or reduce the severity of those bodily anxiety symptoms. And you can feel that the same week of the block. And so think about other anxiety treatments that work swiftly. Benzodiazepines, Xanax, Klonopin, Valium. They work, but they have an addictive potential. So now we can do similar things without having to take a pill every day without the addictive potential. It's a game changer. And like Richard mentioned, the vagus hydrodissection. So that's the part of your nervous system that calms you down after you've been activated. We're activating that. And so now with a 5-minute nerve block procedure, you can experience tremendous relief. Think about PTSD. Some people can't even go outside. Some people can't tolerate public transportation. Some people can't tolerate being in certain spaces that are triggering. And so with a procedure, we now have a swift intervention here that, to be honest, in therapy, which is or can be effective, but can take months to manifest this degree of symptom relief. And so game changer there. TMS, long story short. So when somebody's experiencing depression or anxiety, well, their brain looks a certain way on MRI. There are parts of the brain that are responsible for these depressive and anxiety symptoms, and it looks a certain way, either hyperactive or underactive. Well, that reflects hyperactivity or underactivity of the electrical function of these parts of the brain. And so we know from physics that magnets can influence electrical function. And so if you apply that concept and form a treatment model around it, you have TMS, where basically you receive a number of direct magnetic pulses to those parts of the brain, and you can reduce hyperactivity over a treatment course. So a standard treatment course for depression is 36 sessions over 8 weeks. And so I can achieve a reduction in depressive symptoms. And what I mean is rumination specifically, but a lot of things that's connected to that: low motivation, difficulty concentrating. These symptoms can reduce just by pointing magnetic pulses at that part of the brain that's responsible for producing these symptoms. Again, this is another tool in the toolkit. So if I am experiencing partial symptom relief with therapy and meds, but it's not going any further, now we have another treatment modality. So that's TMS. TMS has applications much broader than the FDA clearances of major depressive disorder and OCD. We can actually treat some psychotic symptoms for people who are suffering from schizophrenia. You can treat depression and mania for people who have bipolar and are either depressed actively or manic actively. You can treat some of the social difficulties of people who have autism spectrum disorder. Substance use conditions can be treated, like cocaine use disorder, alcohol use disorder. Chronic pain is another well-known application of TMS. And so the science is very strong. And so that's another modality. Lastly, the ketamine, that's my baby. That is absolutely my baby. I'll reserve here because we kind of know and may have heard some things about it. So, I mean, I'll stop here, but if there's any questions regarding that, I'm happy to answer them.
Yeah, quick plug for questions. If you guys have questions, we'll probably start in about 6-7 minutes. So feel free to pipe those into the chat. We'll bring you up in about 10 to ask those. But
let me just say prior to that, sure. I think that psychedelics are going to be one of the most revolutionary interventions to come down the mental health treatment pipeline since Freud. And to be honest, I think it's going to be a major contribution to humanity. I'm a huge believer and proponent of what's possible with psychedelics.
Yeah. I wanted to add some stories, as a business person and also as a patient myself. I've seen some really interesting work that I find fascinating. You guys can probably imagine why I got into the space when I heard about all these therapies as a person that had only gone to therapy and taken an anti-anxiety medication of my life. So this is exactly why I got in. So I'm glad to see that people are interested and curious about what's out there. Dr. Green at times treats OCD using TMS. And with that specific therapy, they actually have to trigger the OCD before the magnetic pulses happen. So if you have OCD from a mess, they actually have to make a mess in front of you so that you feel the triggering physical responses to that OCD. If you don't like a particular person, they have to show you photos of that person. It's really fascinating work. It's such an honor to be on the forefront and helping patients with very difficult cases. I would also say that, why do we build a practice in this way? It's not really just to stay cutting edge, but mental health is complex. Most people aren't just dealing with one indication. They're dealing with a blend of multiple ones with multiple severities, some that flare up at times, multiple ones that flare up at another time. And so because we are multimodality clinic, we can sort of uniquely treat patients that have the most complex cocktail of behavioral health issues. My final anecdote that I'll give you is I recently did a neuro reset. I have a pretty high pressure job. One of the reasons why I went on that silly TV show is to promote mental health, but also promote pancreatic cancer awareness. My mother is still fighting it. And I took it as an opportunity and as a springboard to be able to use a platform and talk to many people about things that weren't talked about enough. For living in New York City, trying to do my best as an entrepreneur, building a company, and helping my mom, I constantly am in an anxious state. And frankly, I was, even despite the work that we did, I was a little skeptical about the neuro reset working for me. And I just wanted to describe from my personal experience. I know I'm selling my own thing, but I went into it super skeptical. It was a 10-minute procedure. And the very next morning, what did I feel? First of all, when you get this injection, the way you know it works is you get droopiness of your eye, which is called a Horner syndrome, that goes away in about 4 hours. The very next morning, my fiance comes out of her room when I'm taking calls, and she says, she doesn't know I got the shot, and she's like, "You seem so calm today. Like, what's going on?" And so you still feel you still feel annoyed. The things still annoy you. Someone cuts you off while you're driving on the highway. Someone bumps you while you're on the subway. Your kids are messy, and your spouse is annoying you. Those things will all happen, but it's the response to all of those things that is different. And having done it myself, it's been about 2.5 weeks now. I'm sort of flowing through life at a much less anxious state. Frankly, my interpersonal relationships are better. I'm more productive at work. I'm less stuck in this like rumination, and I'm able to just really focus on everything that I want to achieve and do in life. So, having done one of the therapies myself now, I'm even more of a believer in the work that we're doing, and even prouder.
I think what's really exciting to me, I majored in cognitive science maybe like 17, 18 years ago, and the takeaway from every class was we don't know that much yet. We don't understand the brains, like come back later. And what's really cool is that, not so many years later, many years, depending on how you look at it, like we have come a long way. As you said, Dr. Green, we've had a lot of this technology for a really long time. And we're sort of at this like place now where things are being destigmatized, and we're kind of talking about the technology that's already existed in like a really exciting way. So even that we're like talking about this stuff feels really heartening to me.
I appreciate that, Brett. And I do want to say, Dr. Green always says this: we're not here to demonize anti-anxiety, antidepressants. They are ammunition in the toolkit to be used. You know what I mean? It's part of the toolkit. Just like a hammer versus screwdriver. It does not mean that pills do not work. They should not be used in conjunction with these therapies. It's just another way to get you to feel peace, feel calm.
Just to kind of add to that. So, I mean, another significant component of what we do is called integrative mental health. And so we're seeing a lot of excitement across medicine in general about moving away from specialties as being siloed. You have a heart condition, you're referred to a cardiologist. Your cardiologist may not recognize that your GI symptoms, gastrointestinal symptoms, are in fact related, right? Now, your primary care doctor has the responsibility to kind of put all these pieces together, but now you're spending 15 minutes with them. And so an integrative approach, which is actually arising out of multiple areas of the field, but in mental health, which I'll share how it manifests, is part of this forefront. In mental health, what that means is that you're seeing less of a hyper focus of the psychiatrist, for example, on prescribing meds. Go to your therapist for the therapy. I'm proud to provide both. Therapy of multiple clinical orientations, trauma-focused, CBT, DBT, whatever's indicated, I can do it at the same time as managing medications. Add to that these other tools, and so that we're describing, but added further. In our practice, we have the opportunity, because we have these specialists in-house, we have the opportunity to blend functional medicine and mental health care, which again, this is part of this effort of integrative care, because in reality, these separations are artificial. And so as a psychiatrist, I should ask questions. Is your mental health concerns related to unresolved medical concerns? And no, I'm not going to refer you out. I'll refer you next door to my office. And you can have that conversation. We can develop a comprehensive treatment plan to address both. And in fact, our functional medicine physicians have specialized knowledge of supplements that can actually help with your mental health, which I then supervise. And so, and that's another, again, more tools for the toolkit. Other things, you're seeing this a lot with psychedelics, because psychedelics are bringing together clinicians from multiple disciplines who want to be a part of this movement, and that reflects that integration. And so mental health wise, if I have somebody that's coming to me, let's say for depression, I'm asking about nutrition. I'm asking about the role of physical fitness in your life. I'm asking about the health of your social life. I'm asking about your family, your past. I'm asking about trauma, disappointments in life, dreams deferred or dreams frustrated. This represents integrative mental health. And this, I have to underscore, also represents the forefront, not just these individual procedures. And so I'm very proud that we can offer that level of integrative care in what we do at Hudson.
We have been ending all of our sessions with a couple final questions. You guys could kind of rapid fire those and take them in whatever direction you want. While they answer those, I just want to, and before, I want to thank you guys for your time. Really appreciate it. That was so informative. Would ask everyone in the audience who has a compliment or a thank you to Dr. Green and Richard. Feel free to submit those in the chat. We'll share them with them after if we don't catch you. And we'll ask those final questions to tie a bow on it. The first one is, what's one daily habit you can't live without for your mental health? Whoever has one could go first.
Let's see. Spend some time with loved ones. I think, as much as I'm in the sort of mental health space, I'm also in the longevity side. And the smartest doctors in the world say that community and friends and family is the number one longevity thing that you could possibly do in your life. So I would say that's my number one thing.
For me, I think it's important to, at some point in your day, connect to things that bring you intrinsic joy, pleasure, or satisfaction, or contentment. It is vital as a way to balance all the things you cannot control. And so if you feel that you can connect to, it can be anything. It can be crossword puzzles. It can be anything, literally anything that will give you that little bit of pleasure that lets you know and validates your authenticity. I think it's vital to connect to that a little bit every day. I also think it's vital to find some way of reinforcing your purpose, your reason for getting up, and for reminding yourself that there's a reason for your efforts that day, connecting to that. And if that is a subject of therapy, to discover that, because I work with a lot of people in office who can't necessarily identify that, but make that a focus of the therapy to be able to identify it. For me, it's something that I've had to discover, and it was discovered through talking to older members in my family that really helped me to develop an appreciation of all the people that came before me. And so I connect to the fact that I'm carrying a torch, and that drives me through anything. And so find something to connect to.
Very well said.
I also see a lot of questions on, because we're running out of time. I want to leave you guys all with a tip. So, these therapies outside of, first of all, I commend all of you guys for joining. Thank you for taking the time to listen to us. This is a step in the right direction for everybody, including us on the business side and you guys as people that are, trying to find peace. The tip is to, how do you learn more about these therapies? How do you learn if they're right for you? There are resources out there, resources like you can go to, I forgot the clinical trials. It's like clinicaltrials.gov, something like that. There's another website called PubMed, PubMed. And what I actually like to do, because I'm not a clinician, is I go to these two websites. I do a search for something like the SGB or TMS. I look for the clinical trials and I actually copy and paste it and plug it into ChatGPT. And then I ask it to summarize it in layman's terms so that I can understand if this is right for me. So there's, talking about the information disconnect between the clinicians and the science. How does it get to us? Well, now we have all this technology to help bridge the gap. So PubMed, and I think it's clinicaltrials.gov, do almost like a simple search, find whatever clinical trial that comes up, plug it into ChatGPT and just ask, hey, can you summarize this in layman's terms for me so I can understand it, even though I'm not a doctor? Hopefully that's helpful, guys.
Love that. Yeah, I've been doing the PubMed piece of that, but haven't been doing the Chat GPT side. That's really good. So good tip. Thank you. Final question then is, in both of your opinions, what is the future of mental health? And I realize that's sort of abstract, but you guys could take it in whatever way you wish to.
Dr. Green, why don't you take it?
Yeah, sure. So, I mean, I would actually just kind of bring up something that I kind of touched on earlier, which is more precision, number one. There are quite a few new tools being developed. Some that's known and some that, it's only known for those who kind of look at the literature, but more precision that's going to be possible. It's just vital. It's just vital because, I try to encourage thinking about mental health improvement, not as going straight to the finish line, but in terms of steps. And it's important that those steps you can perceive and see some discernible step forward. And for a long time, as again, I'm a proponent. I've seen countless times that meds and therapy can be transformational. But in terms of precision, there's a lot of variety. Some people really feel that it moves the needle forward in a transformative way swiftly, but a lot of people don't, right? And so I think precision that's going to be possible with a lot of things that are coming on the pipeline is exciting. And then I would say the emphasis on integration is a major thing. Like, I mean, how many times does your mental health clinician really, work with you to develop a nutrition plan or a plan to get you engaged in some respect? Because regardless of your limitations, it's a creative act to figure out how you can be more engaged physically. That can be walking. That can be anything. And so I think the integration piece is a major aspect of this forefront that we're in.
Yeah, I want to piggyback. Precision is definitely the way to the future. It's sort of like the rage in medicine right now across all different medical specialties. I think coming down the pipeline outside of therapies, the diagnostic tools that are available to us are rapidly advancing. So, even Dr. Green, sometime in the near future, will potentially be looking at a set of labs and blood work that is examining the hormone levels in your body, because hormones, affect your mental health. So I think it's not just the therapies that we spent this whole chat talking about, but also what's the data that you have to affect which therapies are right for you at the right order.
That's awesome. Yeah, love it. Thank you guys. Richard, thank you for your advocacy. Thank you for such an informative talk. Dr. Green, thank you for filling in all the gaps of my cognitive science degree that I was left with. All right. Thanks, everyone.